Hello friends, welcome to EasyNurse where nursing education made easy. So we EasyNurse team is back with our Lakshya 3.0 series where we are going to discuss the important topics. So today, second year GNM students, please attend or please listen. So second year GNM students, we are going to discuss mental health nursing. So mental health nursing, we are going to discuss about the important topics and important questions. So attention, second year GNM students. So let's start. So the first we are going to discuss about give the meaning of following words. Some words we are going to define because that is your first section of exam. You need to write for meaning of the word that is given in your question paper. So don't worry, we are going to discuss some of the important for meaning of the following words. So first word we are going to discuss is phobia. So what is phobia? Sorry for that trouble. So first word we are going to discuss is phobia. So what is phobia? It's an intense irrational fear. So that person have a irrational fear will be there. That will be intense fear of specific object, situation or activity. So particularly based on some specific object or some specific event or activity, that person has intense irrational fear. So that is what called phobia. So phobia is nothing but a irrational fear. So next word we are going to discuss is euphoria. So what is euphoria? It's a feeling of extreme happiness. So that person will feel extreme happiness, excitement or well-being. So that condition is known as euphoria. So the person is feeling extreme happiness, excitement or well-being. So that is euphoria. Next word we are going to discuss is rapport. So what is rapport? A harmonious and trusting relationship between people. So as a nurse, you need to have a harmonious relationship with the patient. So that is what called rapport. It's a harmonious and trusting relationship between people. So next word we are going to discuss is apathy. So what is apathy? It's a lack of interest, enthusiasm or concern about things that usually matter. So till yesterday that person had mattered that important thing, but today he is not having any interest to do that things. So that is what called apathy, a lack of interest. So next word we are going to discuss is addiction. So what is addiction? It is a strong dependence on substance or activity that is difficult to control or stop. Example, alcohol addiction. So that person or can't stop or can't stop the use of alcohol, that he is addicted to alcohol. It's mainly in the cases of substance abuse we will see this addiction problems. So next word we are going to discuss is bulimia nervosa. So what is bulimia nervosa? It's an eating disorder. So it is one of the eating disorder where a person eat a lot of food. So that person will eat a lot of food, then tries to get rid of by vomiting. So after having continuously eating a lot of food, then he or she will try to vomit that food. So that is what called this disease condition is known as bulimia nervosa. Excuse me. So next word we will discuss about insomnia. So what is insomnia? Lack of sleep, otherwise it is known as a sleep disorder marked by difficulty in falling sleep or staying in sleep. So the difficulty in falling asleep or sleep disturbance. So that person is not having sleep properly, then it is insomnia. So lack of sleep. Next word we will discuss about mania. So what is mania here? It's a state of abnormally elevated mood, energy and activity level. So that person had abnormal increase in their mood, elevation in their mood. Highly they are active and energy level will be highly, that is abnormally. So that condition is known as mania. Next is compulsion. So what is compulsion? It's an irresistible urge to perform certain actions repeatedly even when they are unnecessary. In the unnecessary situation, they will repeat the actions again and again. So that is what called compulsion. Like washing hands. Example, as a compulsion, they will continuously wash hands if they feel some smell is there in their hands. So that is what called a compulsion. Next we are going to discuss about next word, that is hypomania. So what is hypomania? It's a mild form of mania where the elevated mood and increased activity but without severe impairment. So that person had it's a stage of mania where that person have elevated mood and increased activity but it does not have any severe impairment. So that is what called hypomania. Next word we are going to discuss is neologism. So what is neologism? The creation or use of new made up words. That person or patient who is having the disease conditions words like schizophrenia and all, they will create new words or they'll make a new words often seen in certain mental disorders. So without any meaning, they'll create a new word. So that is what called neologism. Next word we will discuss about is insight. So what is insight? It's the awareness and understanding of a person has about their own thoughts, feelings and behavior. If I have insight means what? I know what I am thinking. I know I am aware of my surrounding. I know what feelings I have. That is what called insight. So it is the awareness and understanding of a one's person's own thoughts, feelings and behavior. So that is what defined as insight. Now next word we are going to discuss is personality. So what is personality? The combination of characteristics and traits that make an individual behavior unique. So each individual has different personality. It is very unique to them. So it is the combination of characteristics and the traits that making our behavior unique. So that is what called personality. So next to define mental illness. So what is mental illness? It's a condition that affect the person's thinking. It's a condition that affects the person's thinking, feeling, behavior or mood, leading to difficulty in functioning the daily life and relationship. So that person's having a difficulties in maintaining the relationship and daily functions, and they have a difficulties in their feeling, thinking, behavior or mood, then it is known as mental illness. Next is amnesia. So what is amnesia? It's nothing but memory loss or loss of memory, either partial, either half memory loss or either complete due to injury, illness or psychological causes, or maybe it's an organic disorder where that person will have loss of memory. Next word we are going to discuss is depression. So what is depression? A mental disorder characterized by persistent sadness. So that person had persistent, continuous sadness. That person is having sadness, loss of interest, lack of energy or motivation. So then it is known as depression. So next word is milieu therapy. So what is milieu therapy? It's a type of therapy that uses a supportive and structured environment to help the patient develop healthy behaviors and coping skills. So we are creating a environment. So that is environment is supportive and structured environment for the patient. So that is what called milieu therapy. Yes, I hope everyone is getting the points. For further information, you can download eCNurse and you can go through second year GNM Mental Health Nursing. So the next word we are going to discuss is delusion. So what is delusion? What is delusion? It's a false belief held strongly despite clear evidence in the contrary. So if we are giving an evidence also, that person will have a false perception or false belief. That is what called delusion. Delusion is nothing but a false belief. Excuse me. So next word we are going to discuss is family therapy. So what is family therapy? It's a type of therapy that helps family members to improve the communication, resolve conflict and support each other on mental health. So we have a patient, we will ask the family to also join in the treatment participation, counseling process, treatment process. So that is what called a family therapy. Alcohol dependent syndrome, or also known as ADS. So what is ADS? Alcohol dependent syndrome. It's a condition characterized by strong craving for alcohol, uncontrolled craving for alcohol, loss of control over drinking. So they don't have any control over their drinking. They'll continuously drink. Tolerance and withdrawal symptoms when alcohol use is reduced or stopped. So suddenly alcohol use is reduced, then they have withdrawal symptoms like loss of consciousness, tremors will be there, irritability, mood changes. That is disease is known as alcohol dependent syndrome. Yes. Now we are going to see about some of the write the following words meaning. So it is a difference between, we are going to see now difference between illusion and hallucination. So what is illusion? It is a false perception of a real object, and hallucination is a perception of something that isn't real. So illusion means if that person in a room, there is a rope is there. So that person will consider that is a rope, but the person will consider it as a snake. That is what called a false perception of a real object. Real object is a rope, but that person is considering that as a snake. So that is what called illusion. So coming to the hallucination, what it is a perception of something that is not there. So like that person is sitting in a room, he is talking to somebody there, that there is nobody else other than that person. So if they have a schizophrenia patient example, they'll have hallucination, means they'll have auditory hallucination, visual hallucination. There won't be nothing, but they'll see the things. They won't be anybody, but they'll hear the voices. So these are the example for hallucination, auditory and visual hallucination. So that's the difference. Illusion is a false perception of real object. A real object is there, but they will think that it is different, like a rope. Rope is perceived as a snake. So that is an example. Coming to hallucination, it's a perception of something that is not real. That is, there is no that real object. They are perceiving that. So next word is obsession. It's a persistent unwanted thoughts. If that person have continuously unwanted thoughts, then it is obsession. Compulsion, repetitive actions to reduce the anxiety, like hand washing. So they have, if they have a tension, they will do uncontrollably hand wash. So that's an example of compulsion. Next is pressure of speech. What is pressure of speech? Rapid and excessive talking. So continuously, fastly, excessively they'll talk. Rapid and excessive talk. Excuse me. Next is poverty of speech, where reduced and limited speech. This we can able to see in the case of a depression patient. They won't talk much. There is a reduced speech and limited speech will be there. So that is poverty of speech, pressure of speech and poverty of speech. Next word is anorexia nervosa. It's a self-starvation and refusal to eat. That person will not eat because of their body. They will think that their body image will change. They'll they'll gain the weight. So that self-starvation and refusal to eat. So that is anorexia nervosa. Coming to bulimia nervosa, it is binge eating followed by purging. Like previously I have told you, they'll eat a lot and after that they'll induce the vomiting by themselves. So that is condition is known as bulimia nervosa. So these are some differences between of the following words. Now, let's move on to some fill in the blanks question. So, in your exam, you will also get the fill in the blanks question. So, let's discuss some of the fill in the blanks questions. So, the first question we will see, fear of height is known as. So, it's a phobia. So, what it is? Fear of height. What it is? Acrophobia. So, the person who is having fear of height, then it is known as acrophobia. False perception is known as, what it is? Illusion. Like I told, in a room, there is a rope is there, but that patient will consider that it is a snake. So, that is what called false perception. It is known as illusion. Increased sense of psychological well-being and happiness is known as euphoria. I have already given the word meaning, increased happiness. That is what called increased sense of psychological well-being and happiness, euphoria. Anti-anxiety drugs are also called what? Anxiolytics. So if it is anxiolytics, is also known as anti-anxiety drugs. Fear or anxiety in a closed space. So what is the phobia here? It is claustrophobia, like a lift. Some people have a fear about the lift, entering into the lift. That is what called claustrophobia. It is fear or anxiety in a closed space. Next is a mild form of depression is known as. What is a mild form of depression? Dysthymia. So if that person have a mild form of depression, it is known as dysthymia. Sleep attack during daytime is called what? It is narcolepsy. The person who is sleeping at daytime or sleep attack in the daytime, it is known as narcolepsy. Imitation of words of an examiner is known as. If your patient is imitating your words, then it is known as echolalia. Imitating the words of other people. So that word is known as echolalia. So loss of memory is known as what it is? Amnesia. I have already given the meaning. Amnesia is loss of memory. A persistent lack of interest, motivation or emotion is called what? Apathy. So that is what? So a persistent lack of interest, motivation or emotion, it is known as apathy. So next word we are going to see is, that is a disorder characterized by alternating episodes of depression and mania. Like today the patient will be in depression and after some time manic symptoms will be present. So that is what called alternating symptoms or episodes of depression and mania. It is called bipolar disorder. So that person is suffering with bipolar disorder where fluctuating between the depression and mania. A mental disorder where a person refuses to eat and maintains abnormally low body weight is called. So that person is refusing, then it is anorexia nervosa. So that person who is suffering with anorexia nervosa, they will refuse the food and they will be very low weight. So that is disease condition is known as anorexia nervosa. So these are some fill in the blanks. Now continue with state whether the following statement is true or false. So you will also get the questions from true or false questions also you need to write in exam in your, you need to write in the exam. So let's discuss some of the true or false questions. Opioids are examples of narcotic drugs. Is it a true or false statement? It is a true statement where opioids are the examples of narcotic drugs. Loss of memory is called amnesia. Yes, it is true statement. We have already discussed it is a true statement. Libido is a term used in the psychoanalytic theory for sexual drive. Libido is a word used in the psychoanalytic theory for sexual drive. It is true. Libido is the word used for that is sexual drive. Next is kleptomania is one of the type of mood disorder. Is it a true or false statement? It is a false statement where kleptomania is an impulse control disorder. It's not a mood disorder. It's an impulse control disorder. So it's a false statement. The organizing principle of personality is called identity. Is it a true statement? Yes. So identity, each individual has different identity. The organizing principle of personality is known as identity. Next word we'll see Asperger's disorder is characterized in an autism spectrum disorder. Is it true or false? It is true. It's a characterized in autism spectrum disorder. Series of words that seem totally unrelated is called word salad. Yes, it is true statement where in psychiatric cases the patient will mix up some words that does not have any connection or any meaning. So that is what called word salad. So it is a series of words that is totally unrelated is called word salad. Alcohol is a central nervous system stimulant. Is it a true or false statement? It is a false statement. It is an CNS depressant. So while taking the alcohol, the person's CNS, central nervous system, will depress. So it won't be stimulating. It is depressing. So that is alcohol is a CNS depressant, not a stimulant. Next is IQ is the ratio between mental age and chronological age. Is it true or false? It is true. So IQ will calculate by chronological age divided by mental age into 100. So this is IQ is the ratio between mental age and chronological age. Catatonia is a type of schizophrenia. Is it true or false statement? It is true. It is one of the type of schizophrenia, catatonic schizophrenia. So schizophrenia is a neurotic disorder. It is false statement because it is a psychotic disorder. So schizophrenia is not a neurotic disorder. It is a psychotic disorder. Now we are going to discuss one by one some important topics. So this is till now we had discussed among some filling the blanks true or false. Now let's discuss by the important topics. So the first one is electroconvulsive therapy or ECT, otherwise known as shock treatment. It is commonly it is defined as shock treatment. So what is ECT? ECT is a medical treatment which controlled electric current are passed through the brain to induce brief seizure used to treat certain psychiatric disorder. Excuse me. So it's a medical treatment. So in the psychiatric setup, we are using ECT. It's a medical treatment which controlled electric current. So we will use controlled electric current to pass into the brain to produce seizures. So the seizures will help to relieve the symptoms of certain diseases. So that's why we are using this, and it's used for psychiatric disorders like depression, schizophrenia. So what it is a shock treatment where we are giving direct electrical current into the brain to produce seizures. So that seizures is thought to be reducing the symptoms of certain psychiatric disorders. So that's the definition of ECT. Now we are moving to the types of ECT. What are the types here? Bilateral ECT. Electrodes placed on both the side of the head. If the electrodes we are placing in the both side of the head, then it is bilateral ECT. Unilateral ECT where one side of the head, usually non-dominant hemisphere. So that if the patient is right-handed dominant side, then we will place it in the left side. Only one side we are placing, that is unilateral. Modified ECT, it's a ECT given under general anesthesia with muscle relaxants to prevent injury. Modified means what? We are giving, first we will give the general anesthesia and the muscle relaxants, then we will give the ECT, then it is modified ECT. Unmodified ECT or direct ECT, what it is? ECT given without any anesthesia or muscle relaxant. Nowadays we are not using this, we are using modified ECT, where first we will give the general anesthesia and the muscle relaxants, then we will give the ECT. So this unmodified is also known as direct ECT. Yes. So this is the types of ECT. Now coming to the indications of ECT. So what are the conditions where we are giving electroconvulsive therapy? Mainly severe depression, especially with suicidal risk. So the person having severe depression and at a risk of suicidal tendency, then we will give them ECT. Treatment resistant schizophrenia. Sometimes what will happen, the patient who we are giving already the medicines, therapy, everything to the patient, but the schizophrenia patient, sometimes they are resistant to treatment, then we will give the ECT. Severe mania, catatonia, catatonic schizophrenia, acute psychotic status not responding to medication. So these are the main indications where we will provide the shock treatment. Now coming to the role of nursing ECT. So as a psychiatric nurse, what will be your role? So here it is, before ECT, we need to assess the patient and obtain the consent, assess the vital signs, we need to monitor the vital signs, we need to get the consent. Also, educate patient and family, prepare the patient, nil per oral, so the patient need to have nil per oral, and also remove jewelry or any dangers present. Now coming to the during ECT, monitor vital signs and safety. We need to, because we are giving them a shock and there will be seizures. So there is a chance the patient will fall down from the bed. So we need to make sure the patient is safety. Monitor the vital signs and maintain the safety. Assess with anesthesia and the procedure. So that is also your responsibility. You need to assess with the anesthesia administration and also muscle relaxant administration and with the procedure. Now coming to after ECT. So what are the things you need to do or consider in after ECT? Monitor recovery and vital signs. You need to monitor the vital signs and monitor recovery of patient. Provide emotional support. Observe for side effect, and if any side effects is there, document. So these are the role of nursing before, during and after ECT. So now let's discuss about the etiological factors of mental disorder. So we are going to see what is the main causes of mental disorder. So what do you mean by etiological factors? Nothing but the causes. So what are the causes here? First is, we'll see mental illness is a condition that affects person's thinking, feeling, mood, behavior, causing significant distress or difficulty in daily functioning. So what are the biological factors here? First one is biological factor. Genetics and hereditary. So in your family, anyone is suffered with a mental illness, the upcoming generation is a chance. There is a chance they will also suffer. So most of the reason it is like that. So genetics and hereditary has play a crucial role in the psychiatric disorders. Brain injury or structural abnormalities. So that is brain, anything happened to your brain, anything happened to that patient's brain, or brain injury or any abnormality. Neurotransmitter imbalance like dopamine and serotonin levels imbalance also will cause psychiatric disorders. Chronic physical illness. So these are the biological factors that leading to mental disorders. Coming to the psychological factors, it is personality traits. Based on the personality traits they have, childhood experiences and trauma like PTSD, post-traumatic stress disorder. If they had any trauma in their past life, it will also one of the reason for a psychiatric disorder. Stress and coping mechanism. So these are the psychological factors. Coming to the environmental factors, family conflict and poor parenting. So if the child had a family conflict with the parents and poor parenting, social isolation and lack of support. So from the society withdrawn or lack of support from the society, cultural and socio-economic influences. So these are the excuse me. So these are the environmental factors. Now coming to the combination factors. So what are the combination factors? Most mental disorders result from mix of biology, psychology and environmental factors. Or not only one reason will be there. These are the mixes. So both the three mix will come in the some of the disease conditions. So in the psychiatric conditions we can see the causes, we can able to see both three factors. So these are the etiological factors of mental disorders. Now let's discuss about another important topic. So this is very important topic. What it is? Therapeutic nurse-patient relationship. What it is? It's a therapeutic nurse-patient relationship is a professional goal-oriented interaction. So it is a professional interaction between the nurse and the patient. It's a goal-oriented nurse reaction between the nurse and patient, where the nurse providing the care, support and guidance to patient to achieve optimum physical, emotional, mental well-being. So what is the goal here? To treat the patient, to get the optimum health for the patient. So this is the relation between a patient and the nurse for the treatment protocol for the patients. It's a completely professional therapeutic relationship. So at the definition, it is a relationship, it is professional, goal-oriented interaction between the nurse and the patient. So that is therapeutic nurse-patient relationship. Now coming to the phases, it has some phases. What is the first phase? Pre-interaction phase. What it is? Occurs before meeting the patient. So before the nurse meeting the patient, pre-interaction phase occurs. So that's the first phase. Nurse review patient history. So the nurse is getting an information that the patient is coming to get admitted in your ward. So you will review his patient history, medical records and the anticipations needed. Plan strategies to build trust and establish therapeutic environment. So you as a nurse, you will plan what you need to do as you to maintain a rapport between the patient. So that is the pre-interaction phase, where you are not meeting the patient first. Before meeting the patient, you will prepare yourself for meeting the patient. So that is pre-interaction phase. Coming to the orientation phase, nurses and patients meet and establish rapport. So here the first phase where the nurse and the patient is meeting with each other and establishing a communication, a rapport between them. Roles, goals and expectations are clarified. So here you will define why you need this relationship to treat the patient. So here goals, and also we will define the goals, also expectation. Nurse performs initial assessment and build trust. So the nurse will do the initial assessment and build a trust with the patient. Third and important phase, that is working phase. So what is working phase? Nurse and patient work together to address the problem and achieve the goal. So what problem the patient is facing, the nurse and client work together to address the problem and achieve the goals and solve the problem. So that is, patient expresses feelings, concerns and challenges. Nurse provides support, counseling and intervention. So this is the working phase. After the planning, we will do the working and we will give the better treatment for the patient. Next is termination phase. So the fourth phase is termination phase, where relationships is concluded after the goals are met. So the patient has treatment completed. So the relationship will come to an end. That is what called termination phase. Nurse help the patient to review progress and prepare for independence. Feeling about separation are discussed and closure is provided. So here either the patient is discharged from the hospital, either the treatment is completed. So their termination of that phase. So that is the last phase. So this is the phases of therapeutic nurse-patient relationship. So next we will discuss about organic mental disorder. It's also one of the important questions that may come for the exam. What is organic mental disorder? It's a mental disorder caused by brain dysfunction due to physical or physiological factors such as injury, infection or disease, resulting in cognitive, emotional or behavior disturbance. It is the brain dysfunction. It is mainly caused by physical or psychological factors like any injury, any infection or any disease to the brain. So what will happen? It will impair or it will cause disturbances in the cognitive, emotional and behavioral things. So that is what called organic mental disorders. So what are the types of organic mental disorders? First one is delirium. So what is delirium? Acute reversible confusion, often due to infection, drug or metabolic disturbances. Due to any metabolic disturbances or any injury, infection or drugs, there is an acute reversible. It's for a short period. That person will have a confusion. It is reversible. We can reverse this. We can treat this disease condition, that is delirium. Next is dementia. It is a chronic progressive loss of memory and cognitive function. Example, Alzheimer's disease. So it is chronic. It's a chronic disease. It is progressive. Day by day that persons have loss of memory. So that is what called dementia. Amnestic disorders. Primary disturbance in memory without other cognitive impairment. Other cognitive impairment will be no thus other cognitive impairment nothing is affecting, but the memory will be affected. That is what called amnestic disorders. Next is organic psychotic disorder. Psychotic symptoms are caused by organic brain damages like hallucinations and delusions will be present. Next is brain syndrome. So due to head trauma, stroke or neurodegenerative diseases affecting the mental function. So these are the types of organic mental disorders. So now let's discuss about the nursing management of dementia. So what is dementia? Nursing management here, safety. We need to prevent false wandering and accidents because they have a loss of memory. So we need to prevent false wandering and accidents. Cognitive support. Use memory aids, orientation cues and routines. So make a plan daily what they need to do. Tell them to follow that. And communication, speak clearly, use simple words and non-verbal cues. You use a simple, clear words to speak with the patient who is having dementia or memory loss. Emotional support. Provide reassurance, patience and reduce anxiety. Daily living. Daily living assistance we need to help with the hygiene, feeding, dressing and toileting because they have a memory loss. They will forget about these daily activities. Environment. Keep surroundings familiar, calm and well lit. So they need to know their environment because to prevent falls and injuries. Family education, teach caregivers about care, behavior management and coping. So these are the nursing management of dementia. Now let's discuss about another important topic or question that may come for your exam is stages of grief. It is by Kubler-Ross model. So what are the stages of grief? First stage is denial. Like an example, a family, a loved one has passed away, death has happened in the family. So first what will be there? Denial. Refusal to accept the reality of loss. They will refuse that. Nothing happened. He is okay. Nothing happened. So they will deny that. They will deny the fact. That is what called refusal to accept the reality of loss. So that is the first one, first stage of grief. Second stage is anger. After denial, what will be there? Anger. So feeling of frustration or resentment about the loss. So they'll feel angry. Oh, why it happened to me? They'll completely get angry. So that's the second stage. Third stage, bargaining. Attempt to negotiate or make deals to reverse or lessen the loss. Like bargaining with the God. God, why you have done to me like that? Why you did that? And if I do something, you will take him back. You will give him back. Like that, they'll negotiate. That is what called bargaining. That is the third stage. Fourth stage is depression. Deep sadness and mourning for the loss. So after that, they'll come to a sadness phase. Oh, that person has died. So they'll come to the depression phase. And lastly, acceptance. Coming to the terms with reality and the loss, reality of loss and adjusting to the life. So they'll accept the fact that that person is no more. So this is the stages of grief. It is based on any event, any particular event, any object or any loved person they lost. So these are the stages of grief. That is, stages of grief include denial, anger, bargaining, depression and acceptance. Now let's discuss about types of crisis. So what is crisis? Types of crisis here. First one is maturational crisis. It occurs during normal life transition. Example, adolescence time and retirement time. Maturational, based on the age it will be, crisis will be there, maturational crisis. Next is situational crisis, triggered by sudden events like example, loss of job, illness, death of a loved one. Third is adventitious or disaster crisis, caused by unexpected external events like natural disaster, accident or crimes. Fourth one is psychiatric crisis resulting from mental conditions, example psychotic break or severe anxiety. So these are the types of crisis. Now let's discuss about defense mechanism. So this is also one of the important question that is usually coming in the previous year question paper. If you take a previous year question paper, you can see defense mechanisms has come multiple times. So what is first defense mechanism? We will see some examples. First one is repression. So what is repression? Unconsciously blocking painful or unacceptable thoughts and memories from conscious awareness. So from the conscious mind, we will unconsciously block a memory. So example, forgetting a traumatic event from childhood. So that person had a traumatic incident in their childhood, but they are not able to recall that. That is what called repression. Unconsciously blocking a painful event or some situation. So next one is denial. So what is denial? Refusing to accept the reality, denying the reality or denying the fact. So refusing to accept reality or facts to avoid emotional pain. Example, a person continues to smoke despite being diagnosed with lung cancer. So that person is diagnosed with lung cancer, then also he will smoke. He will deny that fact that he had a lung cancer. Next is projection. So what is projection? Attributing one's own unacceptable thoughts or feelings to someone else. So they have unacceptable thoughts that you will or project into other person. Example, accusing someone else of being angry when you are angry on yourself. So you are angry on yourself, but you feel that, like an example, in an exam hall, if a student is trying to copy something from other person and got caught by the teacher. So she will tell, me also was doing, that person also was doing. So that is what projecting. I didn't do, she is doing. So projecting your mistake to other person, unacceptable behavior or mistakes to other person, that is what called projection. Next is rationalization. So what is rationalization? Justifying unacceptable behavior, just giving justification about unacceptable behavior or feelings with logical reasons, avoiding true examination. Here, a student blames poor exam performance on the teacher instead of lack of preparation. He or she didn't study only, but they will project that, they'll give rationalization that the teacher didn't teach properly. So that is what called rationalization. Next is regression. So next word is regression. Reverting to earlier stage of development when faced with stress. Example, an adult throwing a temper tantrum when frustrated. When frustrated, they will have a temper tantrum. They will show the angerness. That is what called regression. So these are some of the defense mechanism. Now, next discuss about the next important topic, that is depression. So what is depression? It's a mental disorder characterized by persistent sadness. So that person will have continuous sadness, loss of interest or pleasure in usual activities. So the daily life activities, they don't have any interest to do, feeling of guilt or low self-worth, disturbed sleep or appetite and impaired daily function. So this condition is known as depression. Excuse me. So signs and symptoms of depression. So first, emotional symptoms. So what are the emotional symptoms the patient will have? Persistent sadness or low mood. So they will be having persistent sadness or low mood, feeling of hopelessness, worthlessness and guilt, irritability and frustration. So these are the emotional symptoms. Coming to the cognitive symptoms, difficulty in concentrating or making decisions. So they don't have a difficulty. They have a difficulty to concentrate on a particular thing and to make decisions also. Negative thinking will be there. Suicidal thoughts will be there. So these are the cognitive symptoms. Coming to the physical symptoms, changes in sleep, that is insomnia or hypersomnia, means some completely loss of sleep will be there, or either continuously the person will sleep. So that is hypersomnia. Changes in the appetite and weight, so they won't have any feeling of hungry, so weight loss will be there. So that is changes in appetite and weight loss. Fatigue or low energy they have. So they'll have a fatigue or low energy. Every time they'll feel low energy, and psychomotor agitation and retardation will be there. So this is physical symptoms. Coming to the behavioral symptoms, withdrawal from social activities. So they'll completely withdraw from the society and they will be in their own world. Reduced motivation, neglect of personal hygiene. Even the personal hygiene itself they'll neglect. So these are the behavioral symptoms. So this is signs and symptoms of depression. Now, let's discuss about the medical and nursing management of depression. How you will treat the patients with depression. Medical management, antidepressant medication, selective serotonin re-inhibitors like fluoxetine, and also tricyclic antidepressants and MAO inhibitors. So these are the antidepressants we will give them, prescribe. Doctors will prescribe, psychiatrists will prescribe antidepressants. Electroconvulsive therapy, I have told you already, ECT, because in the severe case of depression with suicidal tendency or suicidal risk thoughts is there, then we will go for ECT. Psychotherapy like CBT, cognitive behavioral therapy, interpersonal therapy. So these are the medical management. Coming to the nursing management, assessment, monitor mood, behavior, sleep, appetite and suicidal thoughts, because we need to be careful because these patients will have a suicidal thought. So monitor or assess the mood, behavior, sleep, appetite and suicidal thoughts. Emotional support. Provide supportive, non-judgmental environment for the patient. Encourage communication. Allow patient to express their feelings. So as a nurse, you need to allow them to express their feelings. Promote self-care. Assist with hygiene, nutrition and activity. Safety measures. Prevent self-harm or suicidal attempts. Education. Teach patient and family about depression, treatment and coping strategies. Monitor medication, observe for side effects and adherence. So these are the nursing management of patients with depression. So as a nurse, you need to monitor the suicidal tendency they have at a risk of suicidal thoughts they have at a risk of suicidal tendency. Yes, next important question, that is the very important topic, that is schizophrenia. So what is schizophrenia? It's a chronic and severe mental disorder characterized by disturbances in the thinking, perception, emotion and behavior leading to impaired reality testing and social functioning. So it's a psychiatric disorder where severe mental disorder characterized by disturbances in the thinking, perception, emotion and behavior. So what are the signs and symptoms of schizophrenia? Positive signs are excess or distortion of normal function. So what are the positive signs? Delusions, they'll have false, fixed belief. Example, belief that others are plotting against them. Like a schizophrenia patient will think that they are talking, if some people are talking, then they are talking about me. They are plotting something against me. So that delusion, they have. Hallucinations, false sensory perception, especially auditory or hearing voices. So if nobody is there also, they'll speak to other person, they'll hear the voices. So that is hallucinations they have, usually auditory hallucination. Disorganized speech, incoherent or irrelevant talk. So they'll have a disorganized speech, that thing, there is no meaning at all, they'll speak irrelevant talks will be there. Disorganized or catatonic behavior, unusual posture, excitement or immobility. So these are the positive signs. Coming to the negative signs, loss of normal functions. It includes affective flatness, reduced emotional expression will be there, alogia, poverty of speech will be there, and avoliation, lack of motivation will be there, and social withdrawal, isolation from others, anhedonia, inability to feel pressure. These are the 4A by Bluer. So what are the 4A here? Affective flattening, alogia, avoliation and anhedonia. So these are the 4 A's in Bluer's negative symptoms. Coming to the cognitive symptoms, poor concentration and attention will be present, impaired memory and judgment, difficulty in decision making. So these are the signs and symptoms of schizophrenia. So what will be the nursing management? Maintain safety, provide a calm, structured environment, remove harmful objects and observe for violent behavior. They usually have violent behavior, so remove harmful objects. Either they'll have a violent behavior towards other self or self-harm. They'll do the self-harm. Build trust. Use honest, consistent communication. Avoid arguing with the delusions and hallucination. Do not try to argue with the delusion and hallucinations. Manage delusion and hallucination. Do not support false belief. Distract with the reality-based activities. So distract them with the reality-based activities. Reassure the patient and use simple, clear language. Promote self-care. Encourage personal hygiene, grooming and daily routine. Medication administration. Give prescribed antipsychotic, example risperidone, haloperidol. Monitor side effects and ensure regular drug compliance. Social support and social and emotional support. Encourage participation in group activities. Provide emotional support and positive reinforcement. Family education. Teach about illness, treatment, relapse signs and home care. So these are the nursing management of patients with paranoid schizophrenia. Now let's discuss about the rights of a mentally ill patient. So the patient, they are also human beings. They also have equal right as a normal human. So what are the rights of a mentally ill patient? Right to access mental health care, to receive affordable and good quality mental health service. So they have the right to get the best treatment for them. Right to dignity and privacy, to be treated with respect and without discrimination. You are not supposed to show any discrimination to the patients who is suffering with mental illness. They are also a part of the community. They also have the right of getting dignity and privacy. Right to confidentiality about their illness and treatment. So they have the right to keep their information privately. As a nurse, you are not supposed to share your patient details to anybody else. So that is okay, of the confidentiality should be maintained. Right to protection from cruel treatment, like no physical or mental abuse or inhuman treatment, like tying them to the bed, beating them. So they are, that is the patients who is suffering with mental illness. In previously in movies and all we can able to see that. So right to protection from the cruel treatment. So they have the right to protect. Right to informed consent, to know about the illness, the treatment option and the giving consent before the treatment. So they have the right to give the consent. Right to communication, to communicate with the family, friends and legal representatives. Right to have personal liberty. No person can be detained or treated against their will except as per legal procedure. So with except any legal procedure, they need to have their personal freedom. Right to community living, to live in society and not to be segregated or abandoned. Right to have legal aid, to get free legal services to protect their rights. Right to complain about deficiencies in services or violation of right. They have the right to complain about all this. And right to advance directive, to decide in advance about their preferred treatment and appointment as a representative, or appoint a representative, or they have the right to appoint a representative from his side, and they also have the right to have a take a decision in their treatment. So these are the rights of a mentally ill patient. Now, let's discuss about another important topic, that is psychopharmacology. So, what is psychopharmacology? It's a study of drugs affects mood, behavior and mental process. It's a study of drugs affecting the mood, behavior and mental process. It deals with the use of medication in the treatment of mental disorders such as schizophrenia, depression and anxiety. So psychopharmacology is nothing but mental disorders treating, that we are using the drugs to treat mental disorders. That is what called psychopharmacology. What is the role of nurse in patient receiving antipsychotic drugs? Your patient is receiving antipsychotic drug. What is your role here? Administer drug as prescribed and on the time. Monitor side effects, drowsiness, tremors, rigidity, hypotension. Observe for serious reactions like tardive dyskinesia, neuroleptic malignant syndrome. Ensure medication compliance. Advise not to stop suddenly. Provide health education. Avoid alcohol, driving and sudden position changes. Encourage follow-up visits and regular lab like a WBC counts for clozapine. Offer emotional support and maintain therapeutic communication. So this is the role of care of patients who is receiving antipsychotic drugs. Excuse me. So next is psychiatric emergencies. So what is psychiatric emergencies? It's sudden disturbance in the thought, mood, behavior or social relationship that require immediate intervention to prevent harm or patient. Example, suicidal attempt, violent behavior, acute psychosis or severe anxiety or panic attack. It's a sudden disturbance in the thought, mood, behavior or social relationship that requiring immediate treatment. So that is emergencies. So nursing management in prevention of suicide. How we will prevent the suicide? Ensure safety, remove harmful objects and provide constant observation. Build trust, listen calmly and show empathy to your patient. Encourage expression of feeling. Allow the patient to talk openly. Administer drugs, give prescribed antidepressants or sedatives. Promote coping, involve in positive activities and provide hope. Educate family, teach warning signs and need for supervision. Refer and document, report to psychiatrist and record all care given. So these are the nursing management in prevention of suicide. Observe the patient for warning signs. You need to observe them and remove all the materials or the things that is helping or that is inducing the thoughts. So these are the main nursing management. Coming to the another important question, National Mental Health Program. So what is National Mental Health Program? Launched in 1982 by the government of India. What are the objectives? Ensuring availability and accessibility of minimum mental health for all the people. So all the people, the cost of the treatment should be less. Integrating mental health with general health services. Promoting community participation in mental health care, preventing and reducing the burden of mental illness and associated disabilities. So these are the objects. What are the components here? Treatment, early diagnosis and management of mental disorders. Rehabilitation, social and occupational rehabilitation of mentally ill patients. Prevention and promotion, mental health education and awareness programs. So what are the sub-programs that's coming in the National Mental Health Program? District Mental Health Program started in 1996 to deliver mental health services at community level. And what are the strategies? Training the primary healthcare workers and using the existing healthcare infrastructure, community awareness and involvement, monitoring and evaluation of the services. So these are the strategies that are coming under National Mental Health Program. Now, let's discuss about characteristics of a mentally healthy person. So, what are the characteristics of a healthy, normal, mentally healthy person? He has the ability to make adjustment. So, he has the best ability to make the adjustment. He has the sense of personal worth, feels worthwhile and important. So, I feel myself I am important. That is one of the characteristics of a mentally healthy person. He solves his problems largely by his own effort and make his own decisions. So that is also one of the characteristics. He has a sense of personal security and feels secure in a group, shows understanding of other people's and problems and motives. So he will understand other people's emotion. He can understand. That is also one of the characteristics. He has a sense of responsibility. He can give and accept love. He lives in a world of reality rather than fantasy. He shows emotional maturity in his behavior and develops a capacity to tolerate frustration and disappointment in his daily life. He has a capacity to manage his life without any frustration, like stress management and all is possible. He has developed a philosophy of life that gives meaning and purpose to his daily activities. He has a variety of interests and generally lives a well-balanced life of work, rest and recreation. So these are the characteristics of a mentally healthy person. Now, let's discuss about the ICD-10 classification of mental disorder. So what are the ICD-10 classification? F00 to 09, it is organic disorders including symptomatic disorder, example dementia, delirium. F10 to F19, it's mental and behavior disorders due to psychoactive substance use like alcohol or drug dependence syndrome. F22 F22-99, it is schizophrenia, schizotypal and delusional disorders. Schizophrenia, example, schizophrenia and delusional disorder. F30 to 39, it is mood disorder, depression, bipolar disorder, mania. F40 to 48, neurotic, stress-related and somatoform disorders like anxiety, phobia and OCD. F50 to 59, behavioral syndromes associated with physiological disturbance, eating disorders and sleep disorders. F60 to 69, it is disorders of adult personality and behavior, antisocial or borderline personality disorder. F70 to 79, mental retardation or intellectual disability, mild, moderate, severe mental retardation. F80 to 89, disorders of psychological development, autism and speech disorder. 90 to 98, behavioral and emotional disorders with onset in childhood or adolescence like ADHD and conduct disorder. F99, unspecified mental disorders, that is not otherwise specified disorders. So these are the ICD-10 classification of mental disorders. It is in the F and code is F and it is in chapters. So it's very important you to study the ICD-10 classification of mental disorders. Next, we will see Indian Lunatic Act. What is Indian Lunatic Act 1912? It's the first law in India to regulate the care, custody and treatment of mentally ill persons. So, the first law that is to care, custody and treatment of mentally ill person. It replaced by Lunatic Asylum Act in 1858. So, what are the purpose here? To provide legal procedures for admission, detention and discharge of persons with mental illness to ensure care and protection of both civil and criminal lunatics. So provisions: classification of mentally ill person as civil or criminal lunatics, appointment of guardians for person and property of lunatics, establishment of asylums for treatment, admission could be made through judicial process by magistrate or court. So what are the replacement? The act was replaced by Mental Health Act in 1987, which gave more importance to the treatment, rehabilitation and right of mentally ill person. Later it is updated Mental Health Care Act of 2017. In 2017, it again updated. So that is Mental Health Act in 2017. So Mental Health Care Act of 2017, it's an enacted by Government of India to provide mental health care and services to persons with mental illness and to protect their rights and dignity. It came into force in July 7, 2018, replacing the Mental Health Act in 1987. So it is to provide mental health care and services to persons with mental illness and protecting their rights and dignity. So what are the key points here? Right to mental health care. So accessing, they are through this through this act, we are giving the quality and affordable treatment, decriminalization of suicide, treated as a mental illness, not a crime. Advance directive, persons can state preferred treatment and appoint a representative. Right of patients, privacy, dignity, informed consent and legal aid. Mental Health Review Board, safeguards right and monitors institutions, government duty. So providing community-based services and promoting the awareness. So this is Mental Health Act 2017. So last question we are going to discuss is obsessive compulsive disorder, also known as OCD. So what is OCD? It's a mental disorder characterized by recurrent unwanted thoughts or obsession, repetitive behavior of persons feels driven to perform to reduce anxiety. Unwanted thoughts and repetitive action. So that is OCD. What are the features? Obsession, persistent, intrusive thoughts, images or urges will be there. Example, fear of contamination, need for order or doubts. Fear of contamination, they'll have excessive hygiene. Like in the case of North 24 Kadam, where we can see Fahd Fasil, the character of Fahd Fasil, there he is having OCD. He'll continuously wash his hands using papers, using cleaners every time. So that is what called a persistent intrusive thoughts, images or urges, obsession. Compulsion, repetitive acts done to reduce this anxiety. Example, excessive hand washing, checking or counting. Insight, the person often recognizes the behavior as irrational but feel unable to stop. They know that it is an irrational behavior, but they are unable to stop the behavior. So that is obsessive compulsive disorder. So we can see OCD in the movie North 24 Kadam and the character played by Fahd Fasil. So what are the causes here? Biological imbalances between the serotonin levels in the brain imbalances, genetic factors, psychological factors like stress, anxiety, learned behavior, environmental factors like traumatic events or family patterns. So what are the clinical manifestations in case of OCD? Repeated cleaning or washing, excessive checking like locks, gases, like after locking the door again and again they will go and check it is locked or whether it is not locked, and arranging things in a specific order. They will every time arrange their things in specific order, repetitive counting and praying, and severe anxiety if rituals are interrupted. If any of this interrupted, they will have severe anxiety. So that the clinical manifestation. So what will be the management here? It is serotonin, selective serotonin reuptake inhibitors will provide, that is fluoxetine, and sertraline will be there. Clomipropamine, that is a tricyclic antidepressant. Psychotherapy, CBT, cognitive behavior therapy, to exposure and responsive prevention. Nursing care, encourage the expression of feelings, do not criticize the rituals initially, gradually limit the compulsive behavior, provide support and education to patient and family. Yes. So till now in the section we had discussed about all the important topics and questions from mental health nursing from the second year GNM. I hope everyone understood. So for each of this following, if each of this we have discussed the topic, you need a further explanation. You can download Easy Nurse from Play Store and App Store, where you will get all the topic explanation with the detailed explanation in video lectures and also with the short notes and detailed notes. So till now we have discussed all the important questions. I hope everyone understood. So all the best for your exams and stay back with Easy Nurse, where nursing education made easy. We will meet in the next sections with another interesting topic.